Celebrating Success, as you know, is an annual event run here in the Trust, and it's about staff who've made a real difference in enabling them to showcase some of the excellent work that they've done. And what we do is that we ask all of our staff to nominate some of the work that they've done over the last year that they feel has really helped to improve and benefit the care that we give to our patients. This year we had a tremendous response. We had 83 projects in total, which is huge. And the way that we look at that is we look at 5 categories against our Pride strategy. And a final one of Team of the Year, which is a team that Sue and John have gone to visit through the nominations. They've been shortlisted, gone to visit through the nominations, and they're the ones that they feel are the Team of the Year for the hospital. But I have to say, all of our staff who have been nominated and shortlisted through this process are all winners. So thank you all very, very much for all your hard work and dedication. One of the things about celebrating success, which I think is quite unique, is the way in which these winners come about. The judges, there are a number of judges from the board and from the governors who actually sit down and give a top 3 who they think should go through to the shortlisting. But then it's actually our staff who vote for them. So it's the staff, their own colleagues, their own peers, who can actually say that they think they've made that success. So well done. And this year, there were over 1,300 votes. Now, when you're on a busy ward or a busy department, you're going the extra mile yourself, actually, to go onto the intranet and vote. So well done to all those people who took the time. So, moving swiftly on, our first category is putting patients first. And the shortlisted candidates are Upbeat. The second shortlisted group is the Reminiscence, I've forgotten it, room, and Memory Cafe on Ward 205. The final shortlisted group is the Motor Neuron Disease Service in around improving the patient experience. And I'm pleased to announce that the winner is the Memory Cafe. Okay, our next category is Right First Time, and the shortlisted candidates are the GP triage system, Don't Fall on Falls. The final shortlisted category was Aspiring for Excellence, and the winner is the GP triage. Our next category of investing our resources wisely, the short-listed candidates are preoperative assessment. The second one is the obstetric physiotherapy triage class. The third and final shortlisted group was for the thermal spreads. And the winner is the pre-op assessment unit. As Sue has said in her presentation, one of our most valuable resources is our staff. And this section looks at how we develop our people to make sure that they have the right skills to provide that high quality care, but also to make sure that Derby is a place that they want to come and work at. The shortlisted candidates are the e-learning team. On a similar vein, the one-stop shops were launched. The final group in this category is the End of Life Discussions DVD and Workbook. And the successful winner is the e-learning team. Our final category this evening in celebrating success is ensuring value from partnership. our shortlisted candidates. The first one is Proceed. The second category is supporting young adults with chronic kidney disease. The final part of this one was Sector-Based Work Academy. And the winner of the final category is Sector-Based Work Academy.
We now come to the Chairman's Award. Before I get to the process of who's shortlisted and who's won, I think it's only fair to point out to you the criteria that we're looking at. None of this will come as a surprise to you because really they're characteristics of all well-run projects. But to list them, very simple terms, we're looking for leadership. Did the team identify a good issue, realise that it really did matter, and did they as a group get stuck in and really take a lead? Secondly, did they work as a team? You know, teamwork is fundamental to the success of any project, however well led. If people in the group are not supporting, not united with the purpose of the group, then it will tend to be far less successful. We're also looking to see, does the project illustrate the concept of continuous improvement? You know, frankly, is it making things better in a measurable and meaningful way? You can often think something's better, but is it? So we need to see evidence that it's measurable success. Naturally, in a hospital, it must be seen to demonstrate patient benefit. Absolutely fundamental point. It has to be of value to all the people who come here looking for care and attention in the hospital. And the last theme I would put to you is that it's good that the project either is of trust-wide significance or application. In other words, it's of benefit to the trust as a whole, or if it's a smaller project, the principles which have been adopted and pursued can be applied elsewhere within the trusts as a matter of good practice. So that's the approach we adopt. Overall, these four groups have achieved a great deal, and they deserve to win, don't they, really, along with many others that we considered. First-rate groups, well-led, well-managed teams, good results. However, somebody has to win. As I said, as a master of technology, with good fortune, you will know any minute now.